your what?
Fulcrum.
Up along your femur is going to be towards your greater trapezius.
Stabilizing arm.
And then down to the lateral malleolus is going to be moving arm. So we're going to start with flexion. I'll get to extension in a second. But you know that if they can get into full extension, that they have a 0, so that you don't need to worry about the 0. And then we'll get to that. But you're going to have them supine. You're going to have them flex their knee up as much as you can. Is this going to be a soft or a firm infeel?
Soft.
Why?
Because the calf and the
Calf, hamstring. I would say most of the time it's going to be a soft, soft infeel. In some cases, if you get maybe somebody who's post-stroke and they've lost muscle mass on that side, or somebody who's just really skinny, you might get a firm ligamentous infeel coming off of that rectus femoris, but most of the time, and probably in this class, in all cases, we're going to get a soft infeel. So first, first range, you're going to do that overpressure. I'm going to feel that soft infeel. Any pain? Doing okay? I'm going to take my Goni eyeball measurement. Now it looks like it's about 150. Normal is
135.
135. Is that what AAO is? Okay. 135. To me, that looks like it's about 150. Any pain?
Dangerous.
I know. I'm going to preset my Goni. There we go. I'm going to have you, actually I'm going to do it this way. Nope, I was right. Okay, bring that knee up again. Still doing okay? All right. Palpating that lateral femoral epicondyle, coming down toward that greater trochanter. And I'm palpating that lateral malleolus, and she's at 139.
Dang.
So quite a bit. Any questions about flexion?
Nope.
So extension, the difference that you guys are going to do for extension, because there's oftentimes people have knee hyperextension, and that's normal. It's not problematic. You want to put a bolster, whether it's a folded towel, pillow, something where you're giving that knee the extra space to get into their full range of motion. Normal is 0 to 5 degrees. So if you see anything in that 0 to 5 degree range of hyperextension, that's totally normal. That would be a firm infeel. So you're gonna do blocking. Coming to the side of your patient, you can stabilize that ankle, and then you're just gonna do a little bit of overpressure just proximal to the knee on that distal femur. Again, getting that firm infeel. I'm gonna come down. She looks like she has about 2 degrees of that hyperextension. So and the difference here is you can leave the knee in this position. You don't have to bring them out of it unless they're symptomatic, if they're having a lot of pain, then you'd wanna bring them out of that hyperextension position. Doing okay?
Mm-hmm.
And I'm getting 3 degrees of hyperextension. Questions, comments, concerns about 0 to 5, so like up to 5 degrees of hyperextension is normal.
With like clinically, if they're just saying, like sitting here, she was at you said 3 degrees, and the patient says that they can go more, would you put
That's why you're
higher?
Yeah, so I did that overpressure. I'm getting that firm end feel. I'm not feeling like I'm pushing her knee down a whole lot, so that's why you do the overpressure, to make sure that you are at true end range. And yes, in a case where you're getting somebody who does have just naturally like 5 or more degrees, you can use a pillow just to make sure, but I'm still getting that firm end feel. I'm pushing her more, but that's also because her foot is on the pillow, so it looks like I'm getting more, but I'm feeling for that firm end. You doing okay, by the way? Yeah. I'm feeling that firm end feel. And this is the other thing. You don't want to like crank down on your patient's knee. It's very easy to give them an extension injury. So you just that slight overpressure.
If she couldn't get the full extension and say she had 5 degrees of flexion, would you actually record that as like knee extension is 5 degrees flexion?
You would say, yeah, patient lacking. I think we talked about like writing 0, tack 5,
right.
Tack whatever the flexion is. But that can get confusing because some people write it as like -5, but then they think that might be hyperextension. So I would always just write patient starting in 5 degrees of flexion, or patient lacking 5 degrees from 0, something like that, where it's
Clear.
more understandable. Any other questions about, is that?
Yeah, so
anything?
the 0, 5, 135, if
Is
that's
the-
what they have, is the clearest way to do it. And then if it was hyperextension, it would be 5, 0, 135.
Cause it's saying the 0, you're not getting to the 0.
Yeah, so if you're at like a clinic and everyone is documenting -5 as lacking, then that's fine. I guess you would have to write like +5 if it was hyperextension or something. So if it's like within your clinic and everyone's on the same page, then whatever you do is fine. But for this class and anything potentially on like the written exam, we would document the way that it is in the learning units.
So if they're lacking, how do you document it again?
So 0, so lacking 5 degrees, they
Yeah.
can't get to 0.
Correct.
It'd be 0, 5, whatever the reflection is. If they're 5 degrees hyperextension, it's 5, 0, whatever their reflection is.
So for Lizzie's
135.
case, it would be 3, 0.
135. Oh, she had, what did I say,
Or
149?
139. Yeah.
139, yeah.
Okay. Understood.
Any other questions? Practice those for a little bit. We'll take a break.